Welcome to this session presented by Mrs. Prudence Hamito. A good care administration or a good healthcare administration depends on a good reporting and recording. Reporting and recording goes hand in hand because all of them can either be it's oral or kind of written. But when we look at recording, it should mostly be written and concise and precise. So recording in midwifery is something very, very important, and we tend to ignore it in most cases because we claim that we are too busy or we are having shortage. But recording is very important in midwifery. So what is recording? Recording refers to documenting patient's care and information in clear, accurate, and organized manner. So in most cases, what we are recording is we are recording or documenting patient's care and information. Whatever information or which is of the patient should be written down clearly, accurately, and in an organized manner. So recording is a crucial part of midwifery practice, which ensures effective communication, continuity of care, and legal protection. So it is through this recording that you can be legally protected in case of any medical errors. Recording should be done promptly after patient encounter and should include observation, interventions, and patient's response. So what do we look at when we are looking at a documentation or when we are looking at patient's recording? So we want to find that you have recorded what you have seen on the patient, what you have done on the patient, and what is the response. So in most cases, we are supposed to record immediately after coming in contact with the patient. So you should not wait until when the patient has gone, then you start writing. I think we can see this thing in, I can give you an example with midwives. For us midwives, we have what we are supposed to record immediately, like the pathograph. So in most cases, because we are very, very, very lazy, we are going to wait for the mother to deliver and we plot the pathograph backwards. That is very, very wrong. Every time you encounter or you examine the mother, you are supposed to record your findings in the pathograph immediately. So let's look at the components of effective recording. One is patient information. Record demographic details, medical history, allergies, and other relevant patient informations. When we are looking at recording, we want details of the patient. It starts right from the social demographic details. I believe we know when we talk about social demographic details. We look at the medical history, any medical history, especially in our line of midwifery. Medical histories are very important for us to know. Allergies and other relevant patient information. Anything which is relevant to the patient's health. So it includes patient's chief complaint or reasons for seeking care for that day. So we tend to ignore this part of patient's chief complaint for seeking care, because when the mothers come to antenatal, we feel like all of them are coming for routine visits, or maybe they are coming to be booked. It's important you ask them, what brings you to the hospital today? Okay, so that is, you're trying to find out the patient's chief complaint. So we go to the next, that is assessment findings. Document comprehensive assessment of the patient's physical, emotional, and psychosocial well-being. So as you're recording, one of the things that you should put down is your findings. After you have done the assessment, what did you find? So you record physically, the patient is this and this, emotionally, social, psychosocially, the patient, including vital signs, pain management, fetal assessment, any abnormalities and deviation. Whatever you have assessed, you put it in writing. So it should be very, very comprehensive. Next is interventions and treatments. So as we know, most mothers who come to us might not really need treatments, but we have prophylaxis that we give them. So you put that under treatment. So record details of intervention, procedures, and medications administered and their outcomes. So as you're dealing with this documentation, when it comes to this part, you are supposed to put those prophylaxis that you give the mothers when they come to antenatal, or if it is in the maternity, what have you done? If at all the mother is having some complications, what treatment have you given? So it includes information on timing, dosage, route of administration, and any specific instruction given to the patient. So when you're writing interventions and treatment, you should make sure you include that at this time I gave this drug, which is this dose, using this route, and instructed the patient not to do this and this, or to do this and this. So that is how you write the part of interventions and treatments. Then we have communication and collaboration. So document communications with the patient, family members, and other healthcare professionals involved in care. So this is very important, very, very important, especially in emergency cases. Sometimes you might be the only midwife working, and then you have a doctor who is on call. Then you're faced with this emergency. You inform the doctor, but the doctor did not come on time. Please note it down that you inform the doctor on this time, or you inform the doctor at this time, you inform the family members, and then if anything goes wrong, you have informed the doctor. It's the doctor who did not appear. Okay, so don't leave that part. Much as you had communicated on phone, it should be also documented. Include clinical notes, consultation notes, referrals, relevant discussions or agreements which were made. If there are agreements which were made, maybe about operations or acceptance or refusal, you document. When it comes to this collaboration and communication, it's very, very important. This is one thing that can make you either to go to jail or not to go to jail. Because if you do not document any communication. Remember, communication is either way, oral or written. So if you don't document whatever oral information that you gave to some other person, the person will have right to deny it. So the next is legal and ethical considerations in most cases during documentation or during recording. One is confidentiality. Ensure that all patient's information is treated with utmost confidentiality and stored securely. Follow legal and ethical guidelines regarding the disclosure and sharing of patient's information if the patient has not allowed you to share her information with family members, with another doctor, with another midwife, whatsoever. You are not supposed to share or disclose. Informed consent. It's very, very important. Document the process of obtaining informed consent from the patient, including discussing about the risk, benefit, and alternative options. Record the patient's understanding and agreement to the proposed interventions and procedure. So this is what really shows that the patient has accepted you. In most cases, when we are during time for OSCE, you find that You just come and explain procedure. Others will not even explain procedure. I've come to put NG tube on the baby. Will you allow me to do so? Then the mother will just say yes. And for you, you will not go and document that part of the mother accepted you. But if now, afterwards, when the procedure goes wrong, then she says you did not actually explain anything. That is how you fall. So you make sure that whatever agreement, understanding that was made between you and the mother is put on writing. That is what we call informed consent. Then we have incident reporting. Document any adverse events, errors, or near misses, promptly or accurately. So in documenting, this part of incident reporting is very, even if you're very lazy, if an incident occurs at your nose or when you are the one who was on duty, even if you don't know how to write, at least make sure there is something written about the incident. So report incidents following institutional policies, procedures, and ensure patient safety and quality improvement. This is the most important part in most cases, because when you talk of incidents, maybe you are taking the patient to theater and the patient fell off before you reach theater, maybe fell off and died from the stretcher, or those are the incidences we are talking about. Or maybe the patient was climbing to delivery couch, fell off, or as she was about to climb off, she delivered and the baby fell off, or the baby fell on the floor and what and what. Those are the incidents you are supposed to document immediately. So we have tools and technologies for reporting and recording. So utilize electronic health record systems and standardized paper-based forms designed for midwifery practice. We have these books in the midwifery, in the maternity there. So whatever kind of health information regarding the mothers, if you have maybe these other health, electronic health kind of recording, you can record. If you have the standardized books, you can record on those standardized books which are used for midwifery practice. Take advantage of technology to enhance accuracy, efficiency, accessibility of reporting and recording. So familiarize yourself with specific tools and systems used in your healthcare setting, ensuring proper training and proficiency in their use. We have this thing of saying, I don't know how to record in that book, I don't know what to put in this part. You should make sure you are familiar with all those books we have in the neonatal book, maternal, obstetric, whatever book which is there. It's not there for just observation or for playing. So you should make sure that all those parts which needs to be filled is filled. Don't say I don't know what to put in this part. Make sure you learn what you should put on that part. So that is all about recording. So we shall, in summary, recording is very important in midwifery aspect, especially after you encounter maybe some kind of errors or some kind of difficulty, or there's any legal cases which is coming. Recording or recorded document can help to back you up, because if there's any mistake and you're taken legally, you find that even your documents can be removed because you don't have any evidence that shows whatever intervention you gave to that person at that time. So make sure that you always record whatever you do on the patient, even including whatever the patient tells you. The patient has refused you to work on them, you record. I can give you an example. There was a time this patient was I was in medical ward, and then he was supposed to be given blood, but because of his religion, being a Seventh-day Adventist, he could not. Their religion did not accept them to receive blood, but he was a sickle cell. He was a non-sickle cell. So now what happens? He refused for the blood to be administered to him. So as you who is handling that particular patient, you go and bring a consent form, or you write that, hi, this person, for the patient. Then if the patient can write, let them write that I, maybe this the name of the patient, have refused blood. Then the person should sign. That is a documented report and can be used for legal issues. In case this person dies, you have evidence that you wanted actually to administer the blood and the person refused. So thank you so much for listening. We shall end our session here. See you again in the next session. Thank you.